Bonjour et bienvenue. Ici, on est sur un feedback un peu particulier. Donc, on est avec Ibrahim. Bonjour Ibrahim.
Bonjour.
Et donc, pour le confort d'Ibrahim, qui est luxembourgeois, lui, il vient suivre les cours. Alors, il a des compétences en français, mais il est plus confortable en anglais. Et je pense que c'était un de ses arguments d'ailleurs pour venir au cours ici, parce qu'ils étaient prodigués du coup en anglais. Et c'est aussi un peu le but, c'est de créer de l'attrait pour d'autres pays éventuellement voisins. Donc, so thank you to come again to the
Thank
courses.
you too for accepting me to come to the course as well.
Oh, please. And so at the end of this year that we spent together, what thing you appreciate, or what would you say to your colleagues, or if something is asking you about Bond, what did you appreciate?
So, well, there are many things I appreciate, and I want to say first that I'm really happy with the course because it met the expectation when I read first the instruction, what
Yes.
the course says, and when I came here and I saw that they were all applicable in the course, so they met them. So what has brought me more that I want to do the course is really I had like lack of doing manual treatment.
Okay.
So and I came here to improve it.
Okay.
Which by the end of it I can say that really I learned a lot from it. So
Okay.
I can apply with my patients manual treatment. What was else is the language of the course. So I don't know, maybe for many students it's maybe not that big, but because the course was in English, so it was easier for me to follow it.
Yes.
So that's for me it's a strong point
Yeah, it's a
for
strong
me.
point. Yes.
And the third point is that it's evidence-based, the course. So everything that we had in the course was supported by literature.
Yeah.
So, which is I can go and do a treatment with my patient and I'm confident that I have a literature backup.
Yeah.
So when I'm applying this technique, I know that it was applied before and it was evidence-based that it will bring benefit to my patients.
Yes, it's really good.
So those are the things that brought me and kept me going and continuing till the end with this course.
Yes. The other thing is, so if you have to summarize in 1 or 2 points, what really changed in your daily practice, or the way you concept your patient or see your patient, what really changed?
So what changed is it helped me, let me put it this, that I can now understand the problem of my patients. So when a patient come to me and I do the assessment of the patient, which is main part we have learned here, how to assess the patients. So, and by the end of the assessment, I can understand the cause of the problem or the condition of my patient. And based on the assessment, I can plan my treatment. So this has helped a lot. So understanding the cause, whether it's MSK or neuro or articular. So, and let's say it was not my strongest point when I started, but now I can go confidently. I go and I deal with my patients and I know how to treat them.
Yeah, and you really felt a difference between you 1 year before and now.
Yeah, I felt difference, and also like I had some we learned some techniques here that I haven't seen before, and I went directly and applied them to my patients, and I saw positive feedback from my patient, which is supporting that what we learned is really a good thing.
Yeah, and so you come from Luxembourg, so some of people ask me, yeah, but is it not too much complicated to organize that coming from here for some days and traveling and all the stuff? What is your feedback?
I'd say no. So it took me 2 hours to come here, so it's not that far.
Yeah.
There are some places around where I can stay, so I think it's fine.
Okay.
Yeah, some people would travel and take flights somewhere to go, but this is really, I think the place is really good. It's not far.
And from your managing patient, create a gap of 1 week. Was it that much challenging for you? Or?
No, when I just planned it well that my holidays are not near the week that I do it, so it's fine.
It's just an organization.
Yeah, so it was fine. It's just to plan it in advance when I know, okay, and that month I will have this week of formation, so I would put my holiday like 1 month after or 2 months after.
Yeah.
So
It's not impossible.
No, exactly, and it's fine. And the good thing when it was also divided, like every 2-3 months there is one block, and they are not only 2 blocks within 2 months. It would be a bit maybe difficult.
Of course.
Yeah.
And it creates you some lights on a wish of courses that you want to follow, or what would be your future, for example, now as a student?
Yeah. So yes, well, what I saw now I'm doing in manual therapy, I would go more if there are like some specific courses and that focus on one member or one joint. So I would follow them. Like for example, doing hand rehabilitation.
Okay.
That's an example.
Yeah.
I would go to it, or dealing with mandibular joints.
Yeah, okay.
So these are things that interest me.
Yeah.
So definitely I will, if there is something available, I would go for it.
And do you find some attract to some different concept of manual therapy? Did you find more good?
Yes, there is, from what we have seen here, the Mulligan concept.
Yeah.
I saw that we saw some of it here,
Yeah.
and I find it interesting. So
Maybe.
if there is one course about it, I believe that I will come again and I will do it.
Okay. Thank you for your feedback.
You too, thank you.
Thank you.
Everyone.